Good morning, good afternoon, good evening. My name is Marisa Gums. I'm the owner and founder of Fight to Be Fit DC. I'm a medical exercise specialist, a fitness trainer, and also a pre and postnatal fitness specialist. And I'm really excited because we're getting ready to launch Core Restore, which is going to be in partnership with Dr. Val of Priority One Wellness. And Core Restore is going to be a comprehensive fitness program for postpartum women that will help with rebuilding the core and not just focusing on the core alone, because there's muscles that help support the core. In addition, the whole body has really shifted through pregnancy and through caring for a new child. So we want to tackle those different muscles and help rebuild and restore to get you prepared to not only take care of your child, but move into more intense exercise. So we don't want to go straight into it, even at that 6-week mark. We want to go ahead and have a progressive approach and really take that time to rebuild. So take those 10 weeks, so you get up to 16 weeks, and then go into more intense exercise. So the idea of the Core Restore is to have that time to get to that point with more intense exercise. So thank you for joining me, Dr. Val.
Yeah, very excited to be here. Thank you for having me.
And Dr. Val is actually a pelvic floor physical therapist. So I'm really excited to partner with you on this. I think this is going to be an awesome program, and I'm really excited to have your expertise. So first of all, when we think about pelvic floor therapy, I think a lot of times we think about it being specific to pregnancy. Is that true, or can you elaborate more on that?
Sure. Although it really should be a part of all prenatal and postpartum care, it's not just specific to pregnancy. So pelvic floor physical therapy or pelvic health physical therapy is for everyone, all genders, and we treat a really wide variety of conditions, some of which are incontinence, constipation, pelvic pain, painful sex, and so much more. So we're not just specific to pelvic persons.
And in regards to pregnancy, how can women prepare for pregnancy? Is there things that they need to be looking out for when it comes to their pelvic health?
Yeah, absolutely. So pelvic health is very important to pay attention to, not only during pregnancy, but also before pregnancy. And some of the ways that people can prepare for their bodies to take on a pregnancy are by strengthening the muscles that are around the pelvis. So you alluded to those earlier, but think about the glutes, the hamstrings, the quads, the hip flexors, and the core, not just the front core, but the back as well. Number two, people can also work on relaxation of the pelvic floor muscles and the vulva to relieve tension, and then worry about internal strengthening as much as is needed. So a lot of times we think, oh, I just need to do a bunch of Kegels, but really the muscles can be too tense and have a little bit too much tension in them to even store up strength or even to build strength, if you will. And then number three, people can address or seek treatment for any pelvic related diagnoses that they might have. So if there's already been a history of incontinence, already been a history of painful sex, things like that, that's something that we would want to maybe address on the front end prior to becoming pregnant, so that it's not a compounding thing during the pregnancy. And as a bonus, people don't typically think about this, but nutrition and hydration, they also play a really huge role in pelvic health. So that should be paid attention to as well in preparation for pregnancy.
Elaborate on that a little bit more, because I think I understand the hydration part, but how about the nutrition? How does nutrition impact pelvic health?
Sure. So without getting too deep into the weeds of the pelvic floor anatomy, there are three layers, and a lot of the functions are starting and stopping the flow of urine, starting and stopping the flow of bowel movements, supporting. And so with relation to bowel movements, what you eat is really important to how you're passing bowel movements. And so if there is constipation, it could be because the pelvic floor muscles are pretty tight and tense. It could be that we need to relax the pelvic floor muscles a little bit more. It could be GI or gastrointestinal related, meaning having to do with the intestines, and the colon. But that's something that a pelvic health physical therapist can help piece out with you together with other medical professionals, to see what is the underlying cause. But at any rate, what you eat does have a significant impact on your pelvic health.
Okay, thank you. Thank you. That makes sense. So I guess we're talking about fiber,
Yes,
right? And
yes,
like
exactly.
if you're not getting enough fiber, if you're not getting enough hydration, you're gonna possibly deal with constipation.
And not only that too, it's about, what types of things you're eating. Like, yes, fiber. Are we having fruits and veggies? Or are we having maybe just a protein shake in the morning, then nothing for a long period of time? What is that doing to the gut, and what is that doing to your overall health of the pelvic floor?
Okay, thank you.
Mhm.
And once pregnant, when is a good time for a woman to visit a pelvic floor therapist?
Really, whenever they feel up for it. So a lot of times there's a lot of fatigue during the first trimester, as you and I are both familiar with. But so I don't recommend, expending further energy trying to make it to physical therapy sessions. But if there are any concerns related to physical therapy, or related to pelvic health, such as, pain, or wanting to have some push preparation for a vaginal delivery, or wanting to prepare for a C-section, and kind of strengthen the body prior to having that C-section, I would highly recommend establishing care at least in the second or third trimester, just to prepare that body really well for delivery.
And can a pelvic floor therapist help improve delivery outcomes, maybe prevent a possible C-section?
Yes, yes, yeah. So I alluded to this a little bit, but I'm really, really glad you asked about it, because we as pelvic health physical therapists play a really huge role in improving delivery outcomes. So sometimes C-sections are planned, and in that case, we can really help people prepare for delivery by addressing any muscle imbalances or any weaknesses, or flexibility in the core and all of the surrounding muscles of the pelvis, like we mentioned earlier. Um, in these cases, we can also prepare the individual for safe ways to maintain the surgical precautions that happen after the C-section, and walk them through what the healing process is going to look like, and what lifting precautions they might have. In the case of a vaginal delivery, though, if that vaginal delivery is desired, we can also help individuals prepare the pelvic floor muscles themselves for delivery, and to decrease that risk of that perineal tearing. So the perineum is that space that usually has that either first, second, or third degree tear, or fourth degree tear. And it is the space between the vaginal opening and the anal opening, on a female anatomy. So we can do that and provide helpful guidance on different delivery postures, in coordination with, maybe, let's say, a doula or a midwife, or someone who's going to be there to kind of help remind us, okay, we can open up our hips in this way, we can help the baby turn in this way. We are really pivotal in helping to remind individuals of those delivery postures for optimal fetal positioning. And then, regardless of whatever type of delivery, we really just help with decreasing that risk of diastasis recti, which you and I are going to really hone in on within that Core Restore program. But that's also known as DR, or ab separation. So we can really help minimize the risk of that.
Okay, very cool, very cool. So I know we talked about tearing and about the core strength and like just different things that are, related to either a C-section or a vaginal delivery. Do you feel like pelvic health? I would imagine that pelvic health is really more impacted by vaginal delivery. But are there things that how is it also impacted in, if someone doesn't have a vaginal delivery? Is there still ways that the pelvic health is really impacted? Because I think sometimes it's people who've had C-sections, they might not think about that as much. They're like, okay, well, I didn't have any tearing, I didn't have anything happen down there per se, right? But how has the pelvic health really been impacted? What are things that may be common even if you didn't have a vaginal?
Sure. So that's a really great question because you're right. When you think of C-section, you don't think that anything is maybe disturbed in the vaginal canal. And so therefore, maybe there's nothing happening in the pelvic floor. But thinking back to what we were discussing earlier about the different um, functions of the pelvic floor, we have one of the things is that it supports. So think of the pelvic floor as kind of a hammock, and it's hammocking all of our pelvic organs. So our uterus, our rectum, our bladder, and it's also holding up all of the other structures above it, being our intestines and all of the organs, right? And so when we have lots of weight coming down, right? Uterus is swollen with a huge fetus inside. That is also something that the pelvic floor has to help maintain upright in the upright position. And therefore, it's taking a lot of work against gravity as we're walking and as we're standing during pregnancy. So 9 months of that later down the line, even though there might have been a C-section delivery, there's still work that has been done with that pelvic floor, and it might have some, I don't want to say repercussions, but it might have some impact on the pelvic floor. So it's worth getting checked out. I think everyone should, definitely seek a pelvic health physical therapist at 6 weeks after birth. Right? Tissues have healed up. And, we give that window of about 6 to 8 weeks, just especially after a C-section delivery. We want to make sure the scar tissue is healed, but we really want to get in and try to help to minimize any impacts of birth. And speaking of a C-section as well, the scar that is developed from that incision or that cut that's done during surgery, that will heal on its own, and it will also develop it can develop a little bit of adhesions, or in other words, the scar and the skin stick together a little bit. So we will go in as physical therapists and massage that scar tissue out so that there's some mobility and some movement of the skin against the muscles so that the muscles can move and activate properly.
Okay. And that you said, and for that massage, is that around the 6 to 8 week mark that you would start with the massage of the scar?
Yes, no sooner,
Okay.
because we do want those tissues, we do want the scar tissue to heal, or the scar itself, I should say. We do want the scar itself to heal well and
Okay.
fully and completely, meaning that both parts of the skin where it was cut open they're back together, no issues. But then we also want to really release that scar tissue buildup.
Okay. And is there a point where, never want to say it's too late, but if it's not done in that 6 to 8 week period, can someone come to you when they're, I don't know, like 2 years later? Is it worth coming in for a massage at that
Yeah, absolutely.
point?
Yeah, it's not gonna be fun. I'm not gonna lie. Scar tissue
Okay.
massage is not like what you would think about like a spa massage. However,
Okay.
it's still impactful. It's still important because to get those muscles and to get the body really moving in its proper form, we really have to release any restrictions that are present to begin with.
Okay. Thank you.
Mhm.
And how about multiple pregnancies? So, I mean, I think we can only imagine how it might be to carry two at one time, but really just let's talk about a mother who had either kids back to back or didn't have a lot of recovery period. Well, they had time to recover, but maybe they didn't do the recovery work. which I think is, sometimes it can be tough as a mother. You're busy, you may be working as well and taking care of your children. So you have a lot on your plate. And sometimes the self-care gets pushed to the back burner at times. So, but you've had one, two, three kids, and now we're trying to tackle your fitness. Can you kind of tell us what can take place at that point, and like what are we looking for at that point? What does that look like?
That's a good question. When individuals come to physical therapy, we take a detailed history. So we get an idea of when symptoms first began. So sometimes it's immediately after a pregnancy, but sometimes it's, oh, this particular symptom, I remember I've had it since my first child, and that was 7 years ago, but now I'm on my third child, you know? I would say that we can always start where the person is. First and foremost, we are always about meeting people where they are. And there's always room for improvement. Even the highest level athlete, Simone Biles, still has some level of improvement, right? So, I would say that even though with each pregnancy, there is a continued and added load on that individual. And if the there hasn't been space or time available to heal and recover from the first one to the second one, or the second one to the third one, there is still an opportunity to enhance and improve strength or flexibility or coordination or that mind body connection. There's still an opportunity to do that moving forward and to get to the point where we're, trying to take people during the core restore program to this higher level of activity and exercise if that's what's desired. Sometimes people just say, hey, I've actually had this back pain since my first child. Here I am 8 years later, and I kind of really just want to work on it. No problem. We can work on it. And it might take a lot of maybe behavioral changes in the way that we're used to sitting, or the way that we're used to standing, or the muscles that we're used to activating. But over time, it can definitely improve.
Well, that's good to hear. That's good to hear, because I think time definitely goes fast, and I think it goes fast as you get older, and then it goes faster when you become a parent, I think.
Oh,
So that's definitely good to know. I think in closing, I just want to go ahead, and if we could just kind of briefly cover, I think what are some of the warning signs that you really need to see a pelvic floor therapist? Um, and then maybe um, also like if someone doesn't feel like they have any issues, they're like, oh, I feel good, like I'm active, I'm fine, blah blah blah. If maybe we can kind of still, because it sounds like it's beneficial for all women who have gone through pregnancy or are about to go through pregnancy to see a pelvic floor therapist, but maybe we can kind of drive that point home a little bit more, and like just think about like maybe like what are like some of the key reasons why, if someone's like, oh, I feel fine though, I feel strong, I feel, everything feels like it's working well, but like what are, I guess, some other points that kind of encourage people if they fall into that category.
Sure. So I think some things that I've noticed in the populations that I work with, and even in my immediate personal circles, there are a lot of things that are normalized that are not normal. So
Okay.
what I mean by that is sex doesn't have to be painful. And sometimes people say, well, it's not really painful. It's just that when I'm in this particular position is when it's painful.
Okay.
That's something to note, right? Because actually it shouldn't be painful at all. And so then we start to uncover, oh, okay, maybe there is something going on with my pelvic floor, or maybe there's a positioning thing that's happening in my uterus, or what is the real driver of this pain that I'm experiencing, right? And then how do I address the pain? Because once we figure out why, then we can address it. And with help, with resources, with different tools, techniques, exercises, we can address that pain and decrease that pain. Another thing that I think about is a little bit of leakage. So I've had friends, family members to say, um, oh, I laugh and I like maybe pee a little. Or, or oh shoot, I had to go to the bathroom really quick when I went inside the house and I had to run to the bathroom. That's another thing. A little bit of leakage, a little slippage, it's also not normal and not necessary. We can definitely address those things in pelvic health physical therapy. So I just kind of think about the things that we've normalized in society. And I really would encourage people, even if you feel like, oh, maybe I'm doing great. I'm feeling good. It wouldn't hurt to get checked if you're, again, having some painful sex, having any type of pelvic pain, even pain during cycles, menstrual cycles, even
Okay.
cramping, even cramping. That's something we can also address in pelvic health physical therapy. Constipation, people, normal is you could poop 2 times a day, or you could go 3 times a week, but it's the type of poop. So we start getting into the nitty gritty of what's your poop looking like, and then people might say, oh well, I guess it's pellets every time. That's something to note, right? That's constipation. So when we throw some words out like incontinence, constipation, people maybe automatically think about like, oh, I'm not old, I don't have to drink prune juice, that kind of thing. But it can happen to anybody, and it can happen for a lot of different reasons. So even an individual who might have like a history of fracturing their tailbone or something, that can have later impacts on pelvic health. So it's, like you said, really beneficial for everyone. And of course, I'm biased, but I think it's beneficial for everyone.
Okay. Okay. Well, I'm definitely sold.
Perfect.
Well, thank you so much. That I think is great information, and I think we even tapped into something else that I think a lot of women will have their interest piqued, because I think more women than not deal with cramps during their menstrual cycle, and the fact that there is something that they can address that women probably haven't tapped into, I think it's awesome, to be able to like, oh, this is something I can actually go to a physical therapist for. I think that's great information, for all women. So thank you for that. And again, I'm really excited about this program we're getting ready to launch. Getting ready to launch it soon. Stay tuned. And again, the Core Restore program will be ideal for women who are 6+ weeks postpartum and have clearance from their doctors. And the idea of the program will be to not only focus on your core, but to focus on the other muscles that support the core, and muscles that have been compromised through pregnancy, or caring for your new child. So just rebuilding that strength so that you're not dealing with pain, and that you're stronger to move forward in daily living and also more exercise. Yes. So
Yes.
thank you so much, Dr. Val.
Thank you so much, Marita. I'm so honored to be here.
Thank you. All right. Have a great afternoon.
You too.